So now that we've gone through these questions, now we're going to get into the topic itself. Overview of fever in children less than 3 months of age. Now, the first thing I want you to understand is that fever in infants less than 3 months old is a medical emergency until proven otherwise. Let me say it again. Fever in infants less than 3 months old is a medical emergency until proven otherwise. And these infants are at high risk for serious bacterial infection. That is why, if you remember in the questions, even though the child is, say, 2 months and the child has obvious ear infection, you want to do some further septic workup to check. Don't just say, oh, it's a simple ear infection, so you can go home with some amoxicillin. No, these infants, that is those less than 3 months of age, are at high risk of serious bacterial infection because of their immune defense, which is immature, and often non-specific presentations are seen when they are going through an infection. So, what are the factors? Number one, the gestational age and birth weight. When you take full-term infants and premature infants are at higher infection risk. Okay. Now, peripartum antibiotics, children whose parents or whose mother received antibiotics around the time the baby was born, or if the child itself was started on antibiotics right from birth. This may mask neonatal sepsis. And what about perinatal complications like chorioamnionitis, prolonged rupture of membranes, right? These increase the risk of infection. So learn these risk factors: prematurity, peripartum antibiotic use, perinatal complications like chorioamnionitis, prolonged rupture of membranes. Now, what about the timing of onset? If the fever starts less than 7 days of age, often it's as a result of perinatal sepsis. If the fever starts after 7 days of birth, it's as a result of community or nosocomial infections. Maybe they picked the infection from the hospital, or they picked it when they went to the community, when they went home. Because usually in Canada, unless like there was a complication in the delivery and the child needs to be in the NICU, or maybe the mother needs to stay in the hospital for some time, usually within 24 to 48 hours, the mother is sent home after the initial metabolic workup is done and the ear testing and all those things are done.